This video presentation is on the hormone cortisol, which is produced by the adrenal gland in response to stress and low blood sugar concentration. Cortisol is a cholesterol-derived hormone that is synthesized in the zona fasciculata of the adrenal cortex of the adrenal gland in response to stress and low blood glucose concentration. So why do we need cortisol and what does it do in our body? Its main purpose is to reduce blood sugar levels, regulate metabolism, and help to reduce inflammation. Many tissues are sensitive to the hormone cortisol, including liver, adipose tissue, and muscle tissue. Cortisol can pass through the cell membrane because of its fat-soluble properties. Once into the cell and in the cytoplasm, cortisol binds to specific receptors. Cortisol affects blood sugar by making adipose and muscle cells resistant to the effect of insulin and thereby increasing the production of glucose by the liver. There is a positive correlation between stress and cortisol production. This can impact how the body metabolizes nutrients. When cortisol is increased, metabolism slows and an individual can gain weight. The opposite occurs when cortisol levels are decreased. Cortisol prevents the release of substances in the body that can cause inflammation. From a clinical perspective, cortisol can be prescribed to treat ailments that have inflammation-associated symptoms. An example of these include allergies and rheumatoid diseases. Over here on the right is a little pictogram of different functions of cortisol. A deficiency in levels of cortisol results in Addison's disease. This is caused when the adrenal glands produce too little cortisol and aldosterone. For patients with this disease, they need to take doses of corticosteroids to increase levels of cortisol in the body. An increase in cortisol levels in the body results in Cushing syndrome, also called hypercortisolism. This disease occurs when too much of cortisol is made over a long period of time. Treatment of this disease depends on the cause. However, some treatments may include surgery, radiation if the cause is due to a pituitary tumor, or cortisol-reducing medication. On the right is an image that summarizes the effects of high cortisol levels, low cortisol levels, and the long-term effects of cortisol imbalances. In summary, cortisol is a cholesterol-derived hormone synthesized in the adrenal glands. Its main purpose is to aid in the controlling of blood sugar levels, maintaining metabolism, and acting as an anti-inflammatory. An inability to produce this hormone results in Addison's disease. An increase in level of cortisol results in Cushing syndrome.